Should you rush into IVF or other fertility treatments? Yes and no. So fertility is a complex process. It has many moving parts in both men and women. A common belief, especially in younger adults, roughly between the ages of 25 and 30, is that if pregnancy doesn't happen right away, within a 3 to 6 month window, you have to rush into a treatment. But fertility is complex, and sometimes treatments are needed, but sometimes your body just needs time. But yes, there are situations when moving quickly makes more sense. So yes, age matters. Female fertility declines with age, especially after 35. And I will put a graph up here to show it. Slowly starts to decline between the ages of 35 to 38. And then at 40, there's just this cliff. So if you're 38 or older, waiting a year may not be in your best interest. If this is the case, seeking treatment earlier is wise. It saves you time in the long run. The second is known medical conditions, such as blocked fallopian tubes, PCOS, endometriosis, or really low sperm count. These conditions make natural conception difficult, and you may need some help. In this case, yes, you should seek treatment as soon as you can, because it takes time for treatments to start working and taking effect. So you have to take that time into consideration as well. Third is multiple pregnancy losses. If you are having recurrent miscarriages, evaluation and treatment can help identify those causes. Fourth is hormonal or ovulation disorders. If cycles are irregular or you're not ovulating, waiting may only just bring more frustration. Early intervention and fertility treatments can improve your chances of success. But also know, there are times when rushing isn't necessary. Like if you're young, if you're younger than 35 and you've been trying for less than a year and you know that there are no known medical issues, that's too soon. Natural conception is still really possible. The second no is if you don't have any medical conditions, at least none that you know of because you've gone through a little bit of testing. At that point, small lifestyle changes like stress reduction, dietary changes, limit your alcohol, please don't binge drink, please don't smoke. I can't believe I'm saying this in 2025. All of these make a big difference in your fertility. And third consideration is financial and emotional costs, because fertility treatments are expensive and they can be draining, and jumping in too early may cause unnecessary stress and anxiety. So when do you go forth and look for fertility treatments? The answer is depends on the context. So a good approach is under 35, try naturally for 12 months before formal treatment. Between the ages of 35 and 37, try for 6 months and then seek evaluation. If you're 38 and older, that's probably an ideal time to go seek evaluation pretty much immediately if you're looking at starting a family. And regardless of age, if you know you have a fertility related condition, please don't wait. Go in and have an evaluation and see what fertility treatments are good options for you. So I want to talk a little bit about egg preservation because I feel like it isn't talked about enough. The ideal age is between the age of 30 and 35, and I encourage women who aren't sure yet if they want a family or if they want one at all, if you have the funds to freeze your eggs, please seriously consider it, because your eggs are going to just decline in quality and quantity after the age of 35, especially after the age of 40. And you don't want to get to the age of 40 and then decide, hey, I do want to become a parent, and now it's going to become much harder for you because of the quality and the quantity of your eggs. So retrieving them now between the ages of 30 and 35 will most likely save you time, money, frustration in the long run. You don't want to get to 40, 45, even 50 and decide that you want to become a parent and not have that option available to you to use your own egg. Just trust me, you will think about how much easier it would have been to have your eggs from a few years ago. If you have the financial means to do so, I highly recommend you consider it. So to summarize, IVF, yes, if you're over 38 and you have known issues or you have specific risks. But no, not if you're younger, under the age of 35, healthy, with no known health issues, and you haven't tried long enough. The key is tailoring the timeline to your unique situation, and your primary healthcare provider can help guide you with that. I hope you found this helpful. Hit like and subscribe because it helps me make more educational videos. And drop me a line if you're thinking of doing IVF or IUIs and which way you're thinking of going. See you in the next one.